Hello friends, let us now learn some important points about sickle cell anemia. In sickle cell anemia, there is point mutation of the codon on sixth codon. There is point mutation of sixth codon on the beta globin. Because of this point mutation, there is replacement of glutamic acid with valine has occurred. Right? So because of this will promote. So this replacement results in formation of hemoglobin S, where you see presence of these sickled hemoglobin. These sickled hemoglobin will become polymerized and it will occlude the blood vessels. So when it occludes different blood vessels, causing the clinical features. So the clinical features, if you see, if those sickled red blood cells occlude the hands and foot, it can cause hand and foot syndrome with pain in the fingers. That is causes hand foot syndrome or pain in the fingers, which is called as dactylitis of bones of hands and foot will occur. And when these sickle cells obstruct the pineal veins, it can cause priapism and it can also cause erectile dysfunction. This priapism is seen in almost 45% of affected males. Then, if these sickle cells obstruct some blood vessels in the brain, it can cause stroke, and if they obstruct the blood vessels in retina, they might cause retinopathy. This retinopathy can lead to loss or decreased visual acuity, and this also can lead to blindness. Then if you see the next, this whenever it obstructs the splenic artery, if these sickle cells obstruct the if they obstruct the splenic artery, when they obstruct the splenic artery, so the spleen undergoes destruction or apoptosis on its own, and this is called as autosplenectomy. Then if it obstructs the renal artery, this renal involvement can result in papillary necrosis can occur, and there is chronic hemolysis, which will decrease or impair the growth of the baby. Then there can be cardiomegaly also, and there can be increased risk of infections with encapsulated bacteria may be seen. Right? Next. Then if you see diagnosis is by anisopoikilocytosis, where you see different types of red cells are seen along with the sickle shaped cells are seen. And there is increased reticulocytes are seen, and you also see cells like target cells. So this is how the target cells look like, and you will also see these are target cells. You will also see the target cells. So these are the target cells, and sometimes we will also see oval jolly bodies are also seen due to asplenia. Then if we do the sickling test, in sickling test we will see we will mix a blood sample with metabisulfite or dithionate. If we mix the blood with metabisulfite and dithionate, it causes sickling of RBC. Then on diagnosis, how do you diagnose it? Diagnosis is by, if you see bone marrow, in the bone marrow there is erythroid hyperplasia is seen in the bone marrow, and if you do spleen biopsy, we see gamma Gandhi bodies are seen on spleen biopsy. And if you do X-ray, we see crew cut appearance of skull is seen on X-ray, and there is fish mouth vertebrae is also seen on X-ray. And we can do hemoglobin electrophoresis. This hemoglobin electrophoresis will detect the hemoglobin S chain, but investigation of choice is hemoglobin HPLC, that is high performance liquid chromatography of hemoglobin is the investigation of choice. We can do prenatal diagnosis. In the prenatal diagnosis, this is done by analysis of fetal DNA is analyzed by amniocentesis and chorionic biopsy. Okay, so this is prenatal chorionic biopsy. Okay, so this is prenatal diagnosis. Then if we see the treatment is we should avoid the infections, and prompt correction of any inflammation is important. Then we have pneumococcal and Haemophilus influenza B vaccine should be given early in life. And if there is acute painful crisis, this is mainly treated by vigorous hydration, and also analgesia should be done to treat this acute painful crisis. Then we can give hydroxyurea for those cases which have severe symptoms, and we can do bone marrow transplantation is done, and gene therapy is also done given for these patients. So this is about the thalassemia. Thank you guys for watching.